Hey everyone, today we're going to talk about something that's on a lot of our minds, either for ourselves or the people we love, dementia. We're going to break down what it is, what it isn't, and most importantly, figure out what we can actually do about it. So let's jump right in. You know that feeling, right? You walk into a room and just stop. You have no idea why you went in there. Or maybe your keys have vanished into thin air again. It's a pretty common worry. Is this just a normal little brain fart, or is it a sign of something more? That's the exact question we're going to tackle. Okay, so let's get one thing straight right off the bat. Dementia isn't one single disease. Think of it more like a big umbrella term. It covers a whole range of symptoms that mess with our memory, our ability to communicate, and our thinking. But here's the absolute most important part, so listen up. It is not a normal part of aging. That's just a myth. To make sense of it all, here's our plan. We're going to start with what dementia really is. Then we'll look at the signs and the stages to watch out for. After that, we'll unpack the main types, see how it's diagnosed and managed, and we'll finish up with some really empowering stuff, what you can do to lower your own risk. All right, first up, what even is dementia? Let's get past that simple, kind of scary word and dig into what really separates its symptoms from the everyday forgetfulness that, let's be honest, we all have from time to time. So this is where we draw a clear line in the sand. On one side, you have normal aging. You forget an appointment, but remember it later, it happens. But on the other side are the signs of dementia. We're talking about a consistent pattern of struggling to find the right words, getting confused in a familiar place like your own neighborhood, or having real trouble managing a budget. The key isn't the single mistake, it's the pattern and how much it affects daily life. Another thing to get your head around is that dementia doesn't just show up and stay the same. It's a progressive condition, meaning it changes and develops over time. Understanding this progression, this journey, is absolutely crucial for families and caregivers so they know what to expect. The World Health Organization breaks it down into 3 general stages. The early stage can be pretty subtle, just seeming a bit more forgetful or losing track of time. In the middle stage, it becomes more obvious, forgetting recent events or people's names, and maybe needing some help with daily personal care. And in the late stage, the person can become quite unaware of their surroundings and need full-time help. It really shows how the condition deepens over time. So, like we said, dementia is that big umbrella term. So what exactly is under the umbrella? It's not just one thing. Let's take a look at the most common types to get a clearer picture. Well, one thing is for sure, Alzheimer's disease is the absolute giant in this space. It is by far the most common cause, accounting for a staggering 70 to 80% of all dementia cases. That's a huge slice of the pie. All the other types fit into that smaller remaining chunk. So let's compare 3 of the most common types. With Alzheimer's, you get these abnormal protein structures, plaques and tangles, that basically gum up the works in the brain, and that's why short-term memory is often the first thing to go. Then you have Lewy body dementia, which is caused by different protein deposits. Its calling card can be wild swings in alertness, and sometimes even visual hallucinations. And with frontotemporal dementia, the protein clumps are in the front of the brain, so the first signs are often big changes in personality and speech, not memory. Okay, so we've defined dementia, we've talked about the types. But what happens next? What do you do when a real concern pops up? Let's shift gears and get practical. How do doctors diagnose it? And more importantly, what can be done to manage it? One of the first tools a doctor might use is a surprisingly simple screening called the mini cog test. It's a quick little 3-step process. The doctor will say 3 unrelated words, like banana, sunrise, chair, and ask you to remember them. Then they'll have you draw a clock face showing a certain time. And finally, they'll ask you to repeat those 3 words. It sounds simple, but it's a really effective way to get a quick snapshot of what's going on cognitively. Now, this is a really important reality check. Right now, there is no cure for most types of dementia. We can't yet reverse the damage that's been done to the brain cells. But, and this is a huge but, that does not mean that nothing can be done. Not at all. The entire focus of treatment is on managing the symptoms and helping the person have the best quality of life possible. Management is really a combination approach. Yeah, there are medications, things called cholinesterase inhibitors, that can help boost memory and judgment. But just as critical are all the lifestyle factors. A healthy diet, regular exercise, good sleep habits, and of course, a safe living space and a strong support system. These are all essential pieces of the puzzle. So what about the rest of us? While some things are out of our hands, they're absolutely proactive steps we can all take to boost our brain health and hopefully lower our risk. This is the final and I think the most empowering part of our whole conversation. This list from the World Health Organization is just fantastic and probably looks pretty familiar. You know that old saying, what's good for the heart is good for the brain? Well, it's 100% true. Exercising, not smoking, eating a healthy diet, keeping your blood pressure and cholesterol in check, these are powerful, powerful tools for protecting your brain for the long haul. So we've gone on quite a journey here, from that little nagging fear of forgetting our keys, all the way to a much deeper understanding of what dementia is and how it's managed. Knowledge really is power. It turns uncertainty into understanding, and that's always the first step. So the final question is just for you. What's your next step going to be?